people, welcome to my channel Physio Guide by Divya. Today in this topic I am going to teach about low back pain treatment, medical management, surgery and physiotherapy management completely. Watch this video till end. You will get a brief idea on it. Next, read the text. Now firstly, medical management. NSAIDs are the most important drugs to be given to decrease low back pain, like ibuprofen, naproxen. As a result, they reduce pain, swelling, inflammation in muscles and around spinal and decrease the damaged spinal disc and arthritis joint. These are the muscle relaxant drugs. And analgesics also are need to be given, antidepressants, anticonvulsants. So okay, these are to be given. Next, epidural steroids. This is an injection, a long acting steroid and a local anesthetic. It affects last for 3 weeks and is used for subacute and chronic cases. This epidural steroids need to be given. Okay, next, surgical management. Absolute indication for whom this surgical management need to be prescribed means for failed conservative management, means by taking medicines also they can't bear the pain, so have severe pain, they can go for surgery. And marked progressive step by step increase of the weakness of the muscle, progressive neurological deficit, cauda equina paralysis. Now relative indications means recurrent episode of incapacitating sciatica, pain unrelieved by complete rest from activity. Okay, pain which is not relieved from complete rest also, they can go for surgery. Now for what are the principles of surgery means, they reduce the pressure on the nerve root by removing the prolapsed disc, dissection of the muscle and bone, okay, need to be removed. Now laminectomy and disc excision, removal of it, hemilaminectomy, anesthetic surgery, fascicectomy, microscopic lumbar dissection. Okay, this surgery needs to be done. Next, assessment. Okay, name, age, gender, occupation, address, and what are the chief complaints, history we need to take, then medical, past and personal family history. Pain assessment, where the pain is seen more, side, frequent, pattern, factors, relieving factors, type of pain, how we need to ask dull pain or sharp pain, burning pain. We need to ask to score the scale from 0 to 10, how much they score the pain. Next, objective, any edema, muscle wasting, posture, how is the posture, gait, walking pattern. Okay, deformity, any deformity or palpation, we need to palpate them, temperature, tenderness, muscle tone, we need to check. On examination, we can understand the vitals, temperature, blood pressure, BP, heart rate, respiratory rate. And motor examination, muscle power we need to test, 0 to 5 mm. Limb length discrimination, we need to check. Myotomes, okay, myotomes and movements by lumbar L to S2, we need to check these movements. Sensory examination, reflexes, we need to do reflexes, jerky movements we need to identify. Dermatomes, okay, dermatomes test, posture, gait, balance, functional assessment. By the scale we need to identify problem list, treatment, short goal or long goal, treatment they are taking, we need to identify. Next, physiotherapy management. First, what are the principle of physiotherapy management is to relieve 3 R's: relieve, restore, recurrent. Okay, this chronic pain, this pain treatment. Next, we need to suggest them corsets and braces need to be suggested to them. This increase the intra-abdominal pressure. The force is diverted against the diaphragm and thoracic spine. This reduces load on lumbar spine. Some of the load will be transmitted to the oblique and transverse abdominal muscles. It provides a sense of security to the back. It provides natural splintage to the back. It corrects the faulty posture. Okay, and it decreases spine movements also. It is supported to increase the movements of the lumbar spine. Now, what are the advantages? It helps to recover, restore. Elder people who cannot tolerate exercise, this need to be given. Okay, advantages and disadvantages also are there. Now, what are the exercise? Starting exercise is this one. Lie on a mat on the back with the knees bent. feet hip width apart, feet width apart here and parallel. Check that your pelvis is level neutral and your spine remains in neutral position. Place a flat folded towel beneath your head. If it is more comfortable, take a few breaths wide and full into the back and sides on your rib cage. Next, first one, pelvic bridging. Pelvic curl to pelvic tilt need to be done. What is this pelvic bridging? How to do means, lie on your back with your knees bent here, knees bent and your feet apart in your floor. Now inhale and exhale. Do a pelvic tilt, upside tilt by engaging your abdominal muscle. I'll tell in brief. Pelvic bridging, we need to rest all the parts. Knee should be bend, and we by applying force downwards with the hand, we need to lift our pelvis, so that this is the pelvic bridging exercise. Next one, chest lift. See here, normally knees are bent, hands are shifted backwards, and see here she is pushing her chest upwards. This is knee chest lift. Okay, repeat for 6 to 8 times and then relax. Again repeat for, so do like that. Now swan prep. In this in prone position only. In this, the patient needs to be lie on a mat face downwards. Keep your arm close to your body and bend your elbows to bring your hands under your shoulders. Now see, she is lifting her head upwards. This is the swan prep. Now child pose, like how the child girl is sitting on the mat with the legs backside bent, and she is bending like this. This is the child pose. Now kneeling arm and leg reach. Say kneeling arm and leg reach. Opposite side, one hand if she is doing left hand, right leg should be moved away. Okay, now cat and cow. See, she is moving down, bending her spine downwards. Here she bending her spine upwards and head downwards. Here upwards. Okay, opposite. Cat and cow exercise. Now like swimming exercise she is doing. See, opposite side swimming exercise. Spine stretch. Here see, she is sitting and she is stretching her spine by bending forwards. Now we need to give this heat therapy, moist therapy to reduce the pain. Okay, this need to be given 10 to 15 minutes. Okay, next exercise, balls also. So what are the back ergonomics? So what are the things we need to do and what are the things we need not to do? Do obtain permission from your surgeon or healthcare provider before beginning the exercise. Do stop if you experience any pain. Do work on a flip resistance mat. Do tie up long hair. Do wear comfortable clothing. Proper weightlifting. While driving, push seat forwards to raise your knee and decrease the lordosis. Flex the knee and the hip when lying on the bed. When lying on the side, turn to side and get up. Okay, we need to don't do this work. Don't wear shoes barefoot. Will avoid for slipping. Don't exercise just after taking meal. Don't ever change your exercise midstream. Completely finish one before starting next one. Don't use high chair. Don't use this soft mattresses that increases lumbar sacral extension. So I hope you understood this topic. Thank you for watching this video.